welcome to your deep dive.
Yeah.
You guys sent in some articles, pretty interesting ones actually, about Republicans and how they feel about the Affordable Care Act.
Obamacare.
Right, Obamacare, as so many people call it.
Mm-hmm.
It seems like you really want to get to the bottom of why public opinion is shifting on this. Like,
Yeah.
what's the deal?
Yeah, it's pretty strange, right?
Yeah.
And especially with healthcare
Yeah.
being such a politically charged issue for so long.
Right.
So we've got this Newsweek article, and it shows some really surprising poll numbers.
Okay.
Republicans are actually starting to like Obamacare,
Wow.
which is crazy. And on top of that, we have all these opinions from Reddit users reacting to this whole thing.
Oh, that's always a good time, Reddit.
Oh, yeah.
So Newsweek's reporting a 12-year high for Republican approval of Obamacare?
Yeah.
19%, to be exact.
Wow.
That's a big jump from just a couple years ago.
Mm-hmm.
Makes you wonder, are Republicans getting more practical when it comes to health care?
It's a good question.
Yeah.
The Gallup poll also found that 32% of Republicans now think that the government should make sure everybody has health care.
Wow.
And that's up from 22% in 2020.
Interesting.
So it looks like it's not just about Obamacare.
Yeah.
It might be a bigger change in how some Republicans view the government's role in healthcare overall.
Do you think it's possible that more Republicans are actually using the ACA?
Uh-huh.
And that's what's shifting their views?
Yeah.
Like, are they starting to see the value in things like protections for pre-existing conditions?
Right.
Maybe because it's affecting them or someone they know.
Mm-hmm.
It's got to be more than just people getting used to it.
They're definitely onto something there.
Yeah.
That Newsweek article, it quotes Chris Fong. He's the CEO of Smile Insurance Group.
Got it.
And he says that a lot of Republican voters are actually benefiting from the ACA now.
Yeah.
So maybe, just maybe, what we're seeing is pocketbook politics.
What do you mean by that?
Well, it could be that people are realizing that if a policy helps them, it's a good policy no matter which party came up with it.
Fascinating.
Yeah.
All right, let's dive into those Reddit reactions.
Okay.
I bet it got a little heated in there.
You could say that.
Yeah.
It's a real mix.
Okay.
They've got shock, skepticism, strong opinions, the whole 9 yards.
So are some people like, wait, Republicans are okay with Obamacare now? What's next? World peace.
Basically.
And others are like, hold your horses. This is all just talk.
Exactly.
Yeah.
Some of the comments are genuinely surprised by these poll results,
Mhm.
and then others are way more cynical,
Okay.
especially with Trump back in the picture.
Right.
You know, you've got people saying stuff like, let's see what happens when Trump actually tries to put his concepts of a plan into action.
Oh, yeah, those famous concepts.
Uh-huh.
Not exactly a detailed blueprint.
Not at all.
One commenter said it perfectly.
Oh, yeah.
They said, Trump's concepts of a plan aren't very reassuring.
That's a good way to put it.
Yeah, right.
So they want to replace Obamacare, but with what?
Exactly. And it's not just about scrapping the whole thing.
Right.
There's also a lot of worry about specific parts of the ACA that might disappear,
Mm-hmm.
like those enhanced premium tax credits.
Yeah.
Those are going to expire after 2025.
Right.
Imagine a family in a red state.
Mm-hmm.
Maybe they're self-employed, relying on those credits to afford health care.
Yeah.
What happens to them if those credits are gone?
It's a really valid concern.
Yeah.
Those tax credits expiring is causing a lot of anxiety. And for good reason. It could have a huge impact on people's lives and their finances, no matter what their politics are.
This shows how these policy debates have real-world consequences.
Absolutely.
It's not just theoretical.
No.
You know, it's not all about the ACA itself.
Right.
Some of those Reddit comments show a bigger debate
Okay.
about how much the government should be involved in healthcare.
Yeah, like those M4A or bust comments.
Exactly. For our listeners who might not know, M4A stands for Medicare for All. It's this idea of a single-payer healthcare system where the government provides healthcare for everyone.
Yep.
And for those who really want M4A,
Yeah.
they see the ACA as a step in the right direction,
Yeah.
but not the final solution.
Not the end goal, no.
So even among people who support some level of government involvement in healthcare,
Yeah,
there's disagreement about how far that involvement should go.
definitely.
You've got those who want a complete system overhaul
Mm-hmm.
and others who are fine with something like the ACA.
Uh-huh.
It just goes to show how complex this issue is
Absolutely.
and how these changing Republican views just add another layer.
Yeah, it's another piece in the puzzle.
Speaking of confusing,
Yeah.
I noticed some comments where people were totally lost about the ACA.
Really?
Like some didn't even know that Obamacare and the ACA are the same thing.
Wow.
It's kind of wild.
Yeah, you're right.
All the jargon around healthcare, it's enough to make anyone's head spin.
Yeah.
Especially when you throw in all the political spin.
Right.
And this lack of understanding just makes it harder to have real conversations about healthcare.
Absolutely.
It really shows how important it is to have clear communication and just basic education about healthcare policy.
Yeah.
Especially in a political climate that's already so charged.
It's essential.
When people actually understand the policies and how they affect them, they can be more involved and informed in the whole democratic process.
Absolutely.
Okay, so where does all this leave us?
Good question.
We've got these shifting Republican views, a whole spectrum of opinions on Reddit, and tons of uncertainty about the future of the ACA under Trump.
Yeah.
It's a lot to unpack.
It really is.
To say the least.
For sure.
Now, to make things even more interesting, let's go back to the Newsweek article.
Okay.
And see what the experts are saying about the future of the ACA.
Sounds good.
One excerpt, Alex Bean, he teaches financial literacy.
Okay.
And he suggests that even if the new administration tries to dismantle the ACA, there could be a huge backlash from the public.
Yeah, he argues that the ACA has become so integrated into our healthcare system that any attempt to undo it could trigger some really negative reactions.
Especially from people who depend on it.
Absolutely.
So even if some in the government want to get rid of the ACA, they might hesitate because of public opinion.
Right.
Even among Republicans.
It seems that way.
It's almost like people are getting attached to the devil they know.
Yeah, that's a good way to put it.
Yeah.
And that's where the analysis gets really interesting.
Okay.
The Newsweek article also quotes Chris Fong,
the CEO we talked about earlier.
Yeah, exactly.
Wow.
And he brings up this fascinating idea.
What's that?
That in a democracy, elected officials should support policies that actually help their voters, even if those policies weren't originally from their party.
You mean they should put what's good for people above scoring political points?
Exactly.
What a novel concept.
I know, right?
But seriously, that's a really interesting point.
Yeah.
It's like practicality is starting to win out over ideology when it comes to healthcare.
It seems that way.
It makes you wonder if this whole trend of rising healthcare costs, regardless of your political views, is the real force behind these changing opinions.
It's a good point.
We're seeing this clash between deeply held beliefs and the need for affordable health care playing out right before our eyes.
In real time.
Exactly.
It'll be interesting to see how this tension plays out as the new administration gets started.
So we've got this mix of changing opinions, expert analysis, and a lot of uncertainty about the future.
Definitely a lot to think about.
It is.
And that's exactly where we'll pick things up in part 2 of your deep dive.
Welcome back to your deep dive, picking up where we left off with those Republican views on healthcare. And you sent us these sources. You want to know what it all means, right?
Absolutely. I'm super curious about what could happen next.
Yeah,
Trump spent years trashing Obamacare.
But now he's got more and more Republicans actually kind of liking it, or at least parts of it.
Yeah.
It's got to be a tough spot for him.
Right.
How's he going to handle this in his next term?
Yeah, it puts him in a really tricky situation. I mean, think about it. He built his whole political identity on being against Obamacare, on those promises to repeal and replace it.
Yeah.
But now a lot of his supporters are actually benefiting from the program. If he alienates them, that could really backfire.
Big time.
It's a real balancing act.
So what's his move here? Could he try to find some middle ground?
Me?
Like tweak the ACA instead of going for a full repeal?
It's possible. Remember those concepts of a plan he kept talking about during the campaign?
Oh, yeah, those...
Super vague.
Very vague.
I think he might try to rebrand some parts of the ACA.
Okay.
Maybe change a few things here and there, then present it as his own awesome solution.
Like a little political magic trick? Dress it up, hope no one notices. It's basically the same thing.
Yeah, he could say he's fixing Obamacare instead of repealing it.
Okay.
Even if the changes are pretty small.
But wouldn't that risk alienating the people in his base who really hate the ACA? The ones who want it completely gone?
Yeah, it's a tightrope walk for sure. He's got to keep all those different groups within the Republican Party happy.
Right.
Not easy.
Especially if he wants to get anything else done.
Yeah.
Healthcare is just one piece of the puzzle.
Exactly. How he handles healthcare will depend on all sorts of political calculations and priorities.
So many factors.
It's going to be really interesting to watch how this all plays out.
It will. Speaking of calculations.
Yeah.
What do you think this shift in Republican views means for the healthcare debate overall.
Hmm.
Do you think this support for the ACA and for the government's role in healthcare is going to last?
That's the big question.
Yeah.
Public opinion is really unpredictable.
Mm-hmm.
It's influenced by personal experiences.
Right.
The media, what politicians are saying, so many things.
So it's hard to say if this is a real change or just a temporary thing.
Exactly. Public opinion on healthcare is always changing.
Yeah.
It's possible that as healthcare costs keep going up, we'll see even more support for government involvement.
Right.
Whether that means strengthening the ACA or moving to a totally different system.
Okay.
Well, that's still unclear.
Yeah.
People are feeling the pressure, and they're looking for solutions.
Especially if they think the private market isn't working.
Exactly. And remember, this isn't just a Republican issue.
Right.
That Gallup poll we mentioned, it found that most U.S. adults, 62%, think the government should ensure everyone has health care.
That's a lot of people.
It is.
It sounds like there's a growing consensus across party lines that something has to change when it comes to healthcare affordability and access.
For sure.
But what that change will look like, who knows?
Exactly. The healthcare debate is far from over.
Yeah.
And these changing Republican opinions are making things even more complicated.
They really are.
They're forcing policymakers to deal with the fact that public opinion is shifting. And that could have big consequences for how healthcare works in the U.S.
Huge implications.
Yeah.
Okay, so we've talked about the political side, but what about the actual policy?
Okay.
What are the most likely scenarios for the ACA's future?
Well, as we've seen, a full repeal is probably less likely now.
Because of more Republicans supporting it?
Right, but that doesn't mean it's completely safe.
Okay.
There are still plenty of people in government and out who want to see it weakened or even dismantled.
So if they can't repeal it, what can they do?
Well, they have a few options.
Okay.
One is through legislation.
Right.
Even if they can't repeal the whole thing,
they
could try to pass laws that chip away at parts of the ACA, make it less effective or more expensive for certain groups.
Yeah, like cutting subsidies or making it harder for people with pre-existing conditions to get coverage.
Exactly. Another option is through executive action.
Okay.
The president has a lot of power when it comes to healthcare policy, and he could use that to weaken the ACA without Congress having to pass any new laws.
So even if the ACA stays in place,
it
could be weakened in other ways.
It's possible, death by 1,000 cuts.
Exactly.
And then there's the legal route.
Okay.
The ACA has been through a ton of lawsuits.
Right.
And it's likely that some of those legal challenges will come back. Maybe even end up back at the Supreme Court.
And that could put the whole law at risk.
It could.
Wow. So it's not just Congress and the White House.
No.
The courts could decide the ACA's fate.
Yeah, they could have a big impact.
It seems like the future of healthcare is really up in the air.
It is.
With all these different forces at play.
Pulling in different directions.
Exactly.
But by understanding these forces, the politics, the policy options, the legal stuff, we can get a better idea of what might happen to the ACA.
A clearer picture.
And that's what we'll keep exploring in part 3 of your deep dive.
All right, we're back for the last part of your deep dive into this whole world of healthcare and what Republicans think about it.
It's a big one.
We've covered so much.
Yeah.
Shifting opinions, potential political strategies, all the policy and legal hurdles for the ACA. My head's spinning.
It's a lot. And the thing is, this whole situation is always changing.
Right.
Public opinion can flip, political priorities shift.
Yeah.
And unexpected things can happen.
It's like trying to predict the weather.
Exactly.
But instead of rain or shine, we're talking about healthcare for millions of people.
It's a good analogy.
So with all this uncertainty, what are the main takeaways?
Yeah.
What's the big picture here?
Well, I think the biggest thing to remember is that the healthcare debate in the U.S. is in uncharted territory. All those old assumptions about what works politically, they're being challenged.
Because more Republicans are actually kind of liking a program their party spent years attacking.
Yeah, exactly.
It's like a political rom-com, the rivals falling in love.
Yeah, and that could totally change how we talk about healthcare in this country. We're seeing a real shift.
It's a little unsettling, like the ground's moving under our feet.
It is unsettling.
So it creates exciting possibilities, but also some serious challenges.
Right. It opens the door for both parties to work together.
Yeah.
But it also adds a lot of uncertainty and instability.
Especially with how divided things are politically. It's hard to picture both sides joining hands in fixing healthcare.
I know. It's really tough to say if this change in how Republicans see things will lead to real conversations and compromise, or if it'll just make the divisions worse.
So what should we be watching for as this all plays out?
Okay.
What signs will tell us where things are going?
Well, a big one is how the new administration talks about its healthcare plans.
Okay.
Will they try to find common ground with the Democrats, work towards a solution that helps everyone?
Right.
Or are they going to focus on dismantling the ACA and pushing their own plan?
And how will Congress react?
Yeah, that's a good question.
Will they be open to compromise or just stick to their party lines?
Yeah, what happens in Congress is really important. If we want any real change, we need the parties to work together at least a little bit.
And we can't forget about the courts.
Oh.
Any big rulings on the ACA could shake up the whole healthcare system.
Absolutely. Any big court decisions could have major consequences.
So we've got the executive branch, the legislative branch, the judicial branch, all potentially shaping the future of healthcare. And then there's public opinion, the wild card.
Right. In the end, public opinion is what drives change. If people demand affordable healthcare, policymakers will have to listen.
They can't ignore the people forever.
Exactly. So it's not just about watching from the sidelines.
Right.
It's about making your voice heard.
So it's not passive, it's active.
Exactly. In a democracy, we all have a role to play.
Okay.
We can help shape a healthcare system that works for everyone by staying informed, getting involved, and speaking up.
So if we had to sum up this whole deep dive in one idea, a guiding principle, what would it be?
I think it would be this. The future of healthcare in the U.S. is uncertain.
Okay.
But it's not decided yet.
Right.
The choices we make today, individually and collectively, will determine what healthcare looks like tomorrow.
So it's not about waiting to see what happens.
Yeah.
It's about actively creating the future we want.
Exactly. By being informed, engaged, and speaking up, we can all help build a healthcare system that's fair and accessible for everyone.
And on that note, we'll leave you with this final thought. What if the rising cost of healthcare, no matter your political views, is the real reason behind all these changing opinions? Makes you wonder if, when it comes to something as vital as healthcare, economics might actually be more important than ideology.
Something to think about.
It is. Thanks for joining us on this deep dive.